You're listening to the Turn Autism Around podcast, episode number 325. I am really excited to record this episode because last time on the podcast, episode 324, I had Dr. Richard Fry on, who was a wealth of information on functional medicine, biomedical treatment, and mainly we talked about leucovorin. And in our discussions before and after we hit record, I was talking to Dr. Fry a little bit about my digital assessment called the Barbera Early Childhood Assessment, or the BECA. So today I am diving in. It'll be a short episode, a solo episode, talking about the Becca and giving you an overview. This overview is for physicians, researchers, as well as parents and professionals. Let's get to it. Welcome back. I'm Dr. Mary Barbera. I'm going to tell you how the Becca came to be and give you a quick overview. If you are listening on audio, that's great, but I do have slides with this presentation, so feel free to hop on over to YouTube or to my website, marybarbera.com/325 to watch the presentation. Okay, so as many of you know that have been long-term listeners, I quote unquote fell into the whole autism world in the late 1990s when my firstborn son Lucas started showing signs of autism after the age of 1 and was diagnosed the day before he was 3. And uh, we didn't have any concerns, even my husband didn't have any concerns until his baby brother was born 18 months later. He had some issues, which I'm going to talk about. And but flash forward to more than 25 years later, and my family consists of my husband, Charles, who is a physician. We did a great episode with him way back in the day. We can put that in the show notes. As well as we have myself, and I am a registered nurse, a behavior analyst with a PhD in leadership. I have been at this for a very long time, and I think because of my nursing background, I've always been trying to piece it together both medically and behaviorally. And then we have Lucas, who still has moderate to severe autism and an intellectual disability. He talks, but he's not conversational. He cares for himself, but he needs 24/7 supervision. And then we have our younger son, Spencer, who is in his late 20s as well. And he is now a physician, just like my husband is a physician. So we come from the whole autism world from a very medical background. So I alluded to Lucas started to have problems after his first birthday. Here he is with a pacifier, which he was addicted to, right around, well, at Halloween. He's in his little Superman outfit. And after his first birthday, looking back in hindsight, he did lose some words and skills. His pointing and waving either stopped or was non-existent. I do have pictures of him waving and pointing when he was younger than 1, so I'm thinking that that stopped. But again, this is the 1990s when we were all very unaware of the signs of autism. He had a low response to his name. We ruled out hearing loss. His play and imitation and following directions was poor. His sleep problems, which he was never a great sleeper, but they worsened. He became a pickier eater. He, as I said, was addicted to the pacifier. He was also addicted to television and VHS tapes of kids shows like Barney. And which was what concerned my husband, he had a lack of awareness of the new baby in our house. I say in my second book, Turn Autism Around, that we could have literally brought home a plastic doll baby for as much as he would have cared or been interested in. So it all kind of um, revolved and proceeded. He went to typical preschool. He got speech therapy once a week. But the day before he was 3 years old, Lucas was diagnosed with moderate to severe autism. Um, and that was a very hard day to have his third birthday because we were grieving the diagnosis, even though we both knew it was coming. We just didn't realize that it was going to be, he was going to be diagnosed with such moderate severe level because he had just finished a whole toddler year of preschool, toddler preschool, and he did relatively well by himself. I had no idea what to do to help him. I had no idea how to get him talking more, how to get him um, potty trained, how to keep his clothes on every time I turned my back. He would strip down. And then I had no idea how I was going to help him, blow out the candles for his first birthday. Um, so that was tough. And when he was 3, Spencer was also 18 months of age. And I was worried about him as well. Now, back in the day, I didn't even know what the early signs of autism were. But Spencer had different issues. He was chronically sick. At first week out of after being born, he had a fever. He was diagnosed with RSV. He had bilateral ear infections, and he was just chronically sick. And so he also had sleep problems, maybe because he was in pain some of the time. He was a picky eater. Was that because I was, struggling getting Lucas to eat? Spencer never took a pacifier, but he was addicted to breastfeeding. He loved trains, so I had heard about kids being obsessed with trains, which wasn't the case for Lucas. And he didn't really talk much until age 2. Again, I didn't know how to get him to talk. I didn't know what to look for. He did not progress to having any kind of delays in autism, but nonetheless, I was confused and overwhelmed and didn't even mention my concerns about Spencer, besides the chronic ear infections, which he had ear tubes and that settled down. But when you have kids, whether they have signs of autism or they're chronically ill or, they're picky eater or sleep or they're not talking much, this is the maze of assessments um, really only get triggered once there is a concern. But the well checks, that's for everyone, pediatric well checks, those are assessments. Um, if you think there's a problem, they can refer you for standardized speech testing. Early intervention, multidisciplinary teams can assess and use a variety of tools. You can have behavioral assessments if your child is really um, having a lot of tantrum behavior or self-injurious behavior or aggressive behavior. Neither of my boys had any of those behavioral concerns. Actually, Lucas was pretty laid back about everything. Occupational therapy testing for self-care skills, for sensory issues. You can get physical therapy evaluations if they're late with walking. Lucas walked at 14 months, which is not considered late, but it was on the later side. Um, the Vineland testing, which is a great test, but as I'm going to explain, it requires a lot. You can get IQ and cognitive testing. Um, a lot of well checks include the MCHAT, which is just a screener for autism. Um, and then if there's concerns, you can also get an ADOS test or STAT test, and these are more for checking for autism. And then there's assessments such as the VB MAP or the ABLES, which is a lot more in-depth testing of their actual skills. But the problems with these assessments for toddlers with delays and potential signs of autism or even potential signs of ADHD in the future, most require that delays have to be detected to proceed with anything past the well check. Trained professionals have to administer the majority of these tests. Standardized testing kits and materials and forms all need to be purchased, and your team needs to be kept up on all of this. Many of these tests need to be done in a clinical setting. There are wait lists, insurance, co-pays, travel time, sometimes hours to get to a center which does these tests. And then most of these tests require at least 30 minutes to administer, and sometimes they require hours to administer, like the BB map for kids who have more skills. So I began creating my assessment, which is now the Barbera Early Childhood Assessment, or the BECA, BECA. I began creating it 2 decades ago. And first it was called the Verbal Behavior Assessment. Then in my latest book, it's called the Turn Autism Around Assessment. And I, within the past year or two, changed the name to the BECA. So my assessment is different because it's easy, digital, and quick. It takes less than 10 minutes to complete. The parent and professionals will get scores in 3 areas plus an overall score, which you can test pre and post any kind of treatment, whether that's medical or behavioral treatment. It crosses disciplines. The BECA looks at self-care, language, and behavior, where the other assessments are very much in silos. You go to this person for this assessment, you go to this person for this assessment. The BECA can be completed by parents by themselves or with professional help. It is free to complete for parents, and the BECA can lead to creating an easy plan and teaching using my method, which I'm now calling the Barbera Method. So I said I started creating this in two decades ago, and I did because I have 2 books. The Verbal Behavior Approach was published in 2007. It's available in 20 languages. The foreword's by Dr. Mark Sundberg. And in the appendix, there is a 5-page verbal behavior assessment form. Fast forward to 2021, my book, Turn Autism Around, with the foreword by Dr. Temple Grandin, has page 49 has the assessment, which is the 5-page assessment turned into 1 page. But these assessments, while they're amazing and really pinpoint all the things that the BECA does, are not able to be quantifiable. And so in 2022, I developed the Barbera Early Childhood Assessment, or the BECA. That is available for free at marybarbera.com/assessment. We fill out the digital assessment, and the parent or professional gets the scores in these areas. So it was only developed or created, this digital version, which is created by a software company. And in 2022, we have 65,000 unique users and more than 3 million data points so far. As I said, it captures daily living and self-care tasks as 1 chunk. That's picky eating, including pacifier addiction, can progress to using utensils, all kinds of eating issues that are common among kids with autism or toddlers showing signs. It also asks questions about sleeping, potty, dressing, and grooming. The next big chunk, which is the major part of the BECA, is language and learning skills, whether your child is not talking at all or almost conversational. It'll capture those skills, and it will quantify them or score them. And then problem behaviors is the last chunk, and that is problem behaviors going from major problem behaviors such as biting and hitting and self-injurious behavior, Two, relatively no major problem behaviors such that Lucas and Spencer showed. Once the 10-minute assessment is done, the email address that completed the assessment will receive the two-page assessment. It is in the same format as page 49 of the Turn Autism Around assessment. And you'll get the scores. You'll also get all of the assessment information that you completed. And then the scores will be highlighted. This is an overall score of 46% for a little boy who ended up not to have autism, but this was his scores at the age of 2. He was showing a pretty significant language delay at the time. He also, surprisingly, was having pretty significant problem behaviors, as well as some sleep issues, hand washing issues, toothbrushing issues, all the things that can definitely get in the way. He was having resistance, wasn't following directions, wasn't becoming independent in those areas. Here's a little boy, Santiago. His mom found my course. He was diagnosed with a significant speech delay. So as you can see, his overall score at the age of 2 was 61%. His self-care was good at 100%. He didn't have any problems in those areas. And his problem behavior score were 64%. The better scores are 100% or 85% or better. But as you can see, his language and learning skills were 20%. So he never got diagnosed with autism, although mom had some concerns, but he was diagnosed with a speech and language delay, and mom took my course, and a year later, his overall score went from 61% to 88%, but his language and learning skills, which was really a problem at 20%, progressed all the way up to 85%. And his problem behaviors got better too, because when kids can communicate, obviously their problem behaviors are going to be better. And mom learned positive child-friendly techniques to get all of these skills to the best level at the same time. So Santiago went on to become, fully conversational, typically developing, and his speech delay was gone. So 25 years later, after my kids had delays and concerns, I have a proven step-by-step system starting with the BECA to help you turn things around. So my ask for you, what can you do to start using or promoting the Barbera Early Childhood Assessment or the BECA? Number one is take the BECA. Go to marybarbera.com/assessment. Take the BECA. Even if you're a researcher or a physician, and you don't have a child in your home or on your caseload with delays or autism, think of a child, a 3-year-old potentially, that you have seen in the past, or that you are, a compilation of all the kids, and just fill out the form and see how easy it is. Fill out the digital assessment. So take the BECA and recommend it to parents. And consider adding the BECA pre and post treatment, whether you're doing medical, biomedical, or behavioral treatment or early intervention treatment. It doesn't matter. If we can start comparing apples to apples, we will be able to move forward. And the third step is to inquire about researching the BECA, or for further training on the BECA and the 4-step Barbera method, you can contact us at marybarbera.com/contact. So that's it. Those are my asks for you to help me get the BECA out into the world. I've made significant financial investments in the BECA. I know it works. We have pre and post BECAs on many, many children, and I'm excited to get this out to the world. So hope you enjoyed this episode. Let me know. I look forward to reading anyone who is reaching out to talk about the BECA So thank you so much for tuning in. Again, go to marybarbera.com/assessment and take your Becca today.